I actually grew up around medicine. My dad was a physician. I was always compassionate about how he was with his patients, and obviously, like I wanted to be part of the battle with the cancer, and then breast cancer specifically, which affects so many women. I think overall that it is going to be amazing, to just being with them, during the hard time, and then help them to guide through their treatment. We see patients like in the first visit after they had the biopsy. I would like, to to know them better by understanding the patient, by kind of their concerns, questions. They usually like feel like very scary because they just receive like the results and they don't know what's going on. So I like to know them better, and then we usually just go through all the imaging and pathology together. How big is the cancer? Where is the cancer exactly? And I like to draw diagrams for them, about the whole treatment. And I want to be kind of help them to understand the situation, be be supported, and also help them to be confident about the next treatment plan. If the patient has the options, for lumpectomy, which is the partial mastectomy, or we do offer them, if the patient's has very extensive disease, we may just offer them the mastectomy as the safest option to go. We have the options, for the minimal invasive mastectomies with the small incision, in selected patients, the nerve preserving mastectomy, and then immediate the breast reconstructions, collaborating with the plastic surgery team. The most rewarding part of my job is being with the patients from the beginning, and then help them to understand the situation, help them to know all the treatment options, and I think overall guide them through the treatment. And it's nice to see all these patients getting back to their normal life and then recovery, which is, I think, that never gets old.